So a lot of you keep asking me about the fellowship opportunities that we have after dermatology. So I'm going to speak of the fellowships that have been listed on the IADVL page. So this one's on HIV medicine. I think it's a good investment of your time if you're really keen on helping people who are suffering with HIV/AIDS, because HIV, the incidence of HIV is going to increase. The longevity of people is also increasing. So we eventually have a lot of people who will be suffering with HIV/AIDS. So if you have a good knowledge of it, it might help you. There are very good fellowships in the foreign countries also which people do. Other fellowship is laser aesthetic dermatology and dermatosurgery. It's the most in one, I say. It's the one that you're going to practice a lot in your clinic. But to be honest, I have been to a few clinics where it is being done, and I think that it does not need a lot of time, because dermatology and dermatosurgery, again, they do not need a lot of time, but still you can do like a month or two. But spending years on it, according to my opinion, is not a very good investment of your time. Then there is aesthetic dermatology. So that's again like the same laser aesthetics and dermatology. Dermatopathology, I think, is something that you can still invest a little time on, because we all rely on pathology reports for the final diagnosis. And if we have good people doing the reporting, the diagnosis and the management would be much, much better. So this is something that we can still spend time on, and this is something that we can learn, that might have kind of a learning curve. And there's a fellowship on urticaria, so it's more like a research topic. If you're doing a fellowship on urticaria, I think research and all is better outside of India, but then I'll ensure that whoever's holding it, I'll go to their clinic and get information for you someday. Then there is one on immunofluorescence. Again, this fellowship also I think is like for people who are into research and all. Trichology, there's one fellowship on trichology. I think trichology is a very good investment of your time, because we'll be doing trichoscopy, we'll be doing hair transplants, we'll be doing PRPs, we'll be doing microblading. But I think it'll have a lot of things, so I think it's a good investment of your time. Then there is clinical dermatology and HIV medicine. I personally feel that if you've not learned clinical dermatology in your PG, that's a very shameful thing to do. Then there's one on pediatric dermatology. The thing is, again, pediatric dermatology is something that you should learn during your PG years only. But then I think that it's all inclusive. So clinical dermatology and pediatric dermatology are kind of the fellowships for people who are not very confident and who think that they need an overview or a bird's eye view of everything from some expert person. So if you do clinical dermatology or you do pediatric dermatology, your lasers, one fellowship on leprosy. People say that leprosy has been eradicated. People say that the incidence is less, but I think leprosy is still very much there. And until we completely eliminate it, this fellowship is going to be in. But again, I feel that leprosy is something that you should really, really learn during your PG only. It's tough. It might take time, but try to learn as much as you can, and then eventually build on it as you see patients keep reading. Then there's one on phototherapy. This I personally find very interesting because I've seen SIG videos, and I feel that this is something like. But I think again, phototherapy would be something that I'll probably learn in like 2-3 months, and then I'll be like, okay, I have nothing else to learn now, so I don't need like a year's fellowship on that. But then it's a very completely different thing. It is something that was practiced a lot in ancient India, and we're not practicing it as much right now, but I guess effective. Then there's one on dermatoscopy. Amazing fellowship. I think this is something that can take like more than 3 months or so, because if you use a dermatoscope, no, people say there are research papers that say that your diagnostic efficacy is increased by 30%. I think that it's increased a lot more than that, because dermatoscope makes it so much easier to understand things and to diagnose lesions, because everything looks the same on the outside, but under that scope it looks really amazing. Now, one on dermatosurgery, again, like the procedures and all that you do, I think you should keep a check on what all procedures are there in the market. You should keep reading some good journals and all. But spending too much time again is not very fruitful, because the learning curve is like not that much. Because I had attended like this workshop at Ames, this 2-day workshop where they was teaching the dermatosurgery things, and I think in 2 days that covered like almost everything. So that gave me an idea, like it's not a lot. It's not a lot of things that you have to learn here. Then there's photodermatology. I do not have a lot of knowledge. If it's phototherapy only, then I know. But I think photodermatology would be different. I do not have a lot of knowledge about it. Maybe somebody in the comment section can probably write about it, and maybe I can remake this video once I have a lot more knowledge. Then there is Yeah, so that's all. I think if you go to foreign countries, there are fellowships on allergies, there are fellowships on immunity, there are fellowships on nose surgery, and there are a few other fellowships. I'll put them in the inside if I can. And that is why I think that we can learn a lot from the countries outside of India and bring that those things here because we have like similar skin diseases, but these people know a few things more than we do. So yeah, that's the whole deal. Anyways, thank you for watching this video and let me know in comments what all do you want me to make a video on and I'll do my research and come back with the facts.